Hello, Dr. Sean McCorkle again here at Summer Creek Animal Clinic. Last time we spoke about gum disease, and today I wanted to talk a little bit more about the process of addressing that disease with a dental procedure, or more accurately, what we call a comprehensive oral health assessment and treatment. And so the first thing that we need to talk about regarding a dental procedure is the anesthetic component that is really necessary in order to address the infection and inflammation like we talked about last time. So the anesthetic part is really important because we want to do everything we can to minimize the risk for your pet during the dental procedure. So it's very important with whoever's doing the dental that the anesthetic component is taken very seriously. So two important steps before the procedure is a good physical exam to make sure that the heart sounds good and there's nothing else externally that would potentially increase the risk of anesthesia. And the second step that's really important is doing some at least basic lab work or blood work to evaluate internally to make sure that the main organs are functioning well to again decrease the risk of anesthesia. In the anesthetic process itself, the way that we operate and the way that we would recommend for any dental procedure is making sure that we've got an IV catheter placed, IV fluids to maintain adequate blood pressure, and then really detailed monitoring with really good equipment to make sure that the heart is good throughout the procedure, blood pressure is good, we're oxygenating well, our temperature is being maintained, and all of that stuff is very, very critical to ensure that we minimize the risk. And if that's all of those steps are done appropriately, the risk is really, really low. Then once the anesthetic part is hammered out and we have a good detailed plan, then we can actually get into the procedure and what that looks like. And unfortunately, across the board in veterinary medicine, there's not a really well-defined standard, and so you're not going to necessarily get the same level of care at practice A as you would at practice B. So it's just really important for you as the consumer to understand what's necessary in order to do a good dental procedure. So the first step is to ensure that dental x-rays are being taken of the entire mouth every time your pet is going under anesthesia for a dental procedure. This is very critical to be able to evaluate the disease under the gum line, which if you remember from last time, that is really what doing a dental procedure is all about, is removing that infection and inflammation under the gum line that you can't see with the naked eye. The dental x-rays are critical. Then the second step is a doctor doing a very thorough oral exam with probing around each individual tooth to evaluate for pocketing, fractured teeth, tumors in the mouth. Being able to evaluate those things under anesthesia is critical because you're never going to be able to do that thoroughly enough when they're awake. And then taking those two steps together and then evaluating that mouth. And so how we do that is we get the x-rays, we do the oral exam, and then while the technician is cleaning the mouth, doing all of the ultrasonic scaling, getting rid of all the tartar above and below the gum line as best as possible, while the doctor is reviewing the dental x-rays and the oral exam findings, and then communicating with you as the client during the procedure to discuss what needs to be done, because we can't do the diagnostics, the dental x-rays and the oral exam until they're under anesthesia. We want to try to make things as efficient as possible and try to get it all done in one procedure. And so we're calling and discussing those findings with you, and then by the time we're off the phone, usually the mouth is done being cleaned, and then we can get into the next stage of the dental procedure, which really just depends on what those findings are. And so in the next video, we'll talk a little bit more about some of those potential findings and what we can do to address that.